Hi, I'm Dr. Abhinandan Punit. I'm a consultant orthopedic surgeon at Narayana Health City. I specialize in robotic-assisted joint surgeries and minimally invasive hip replacement. Today we will talk about robotic-assisted knee replacement. Traditionally, we have been performing knee replacement using a mechanical jigs, and the outcomes were good. However, around 10% of the total population across the globe were not happy. So, orthopedic fraternity across the globe have been wondering what is the reason why around 10% of total population who undergo total knee replacement are not happy. So, is the robotic going to answer and will be the future for joint replacement? Now, it is a robotic assisted surgery where the robot will help the surgeon in making the planning and execution of the plan to a certain extent. Now, there is a sort of myth in the general public that robotic surgery means the robot only is going to do the surgery, which is partially correct. Now, when you classically divide, they are called active robot and a semi-active robot. The active robot is capable of carrying out the complete operation anonymously on its own. However, it does require intervention of a surgeon during the procedure. Whereas a semi-active robot are the robots which needs surgeon involvement to do the bone preparation. Now, to list the advantages of robotic assisted technologies, one is precise alignment of the leg, which I mean we can correct the deformity. If people have a crooked leg, we can try to make it as straight as possible using the robotic technology. It is minimally invasive, that means patient will have less pain post-operatively. The recovery is faster compared to a manual knee replacement, and because the recovery is faster, they can go back to work sooner than a manual knee replacement. The patient satisfaction, that means the patient who undergoes knee replacement are more happier and they are satisfied with the procedure in a robotic group compared to a manual group. So these are the few salient features which are for the robotic assisted technology. Now, by saying a robotic assisted technology, it does not mean that manual replacement is not good. If there is a option of a robotic versus manual, it is always better to undergo a robotic assisted knee replacement because of the advantages. Thank you.